1,489 Ayushman Arogya Mandirs have been completed by the Ministry of Ayush in these 100 days. National Accreditation Board for Hospitals and Healthcare provides has been completed the evaluation of 1,489 Ayushman Arogya Mandir and 1,005 of these have been certified for Ayush entry level certification. This initiative is an important step in ensuring quality healthcare services under the National Ayush Mission. As of August 5th, 2024, there were 552 operational Ayushman Arogya Mandirs in Tamil Nadu. And second key achievement is special medical stores for Ayush medicines. To guarantee easy access to Ayush medicines, the Honorable Minister Sri Prataprao Jadhav has announced on August 26, 24 that the government intended to open special medical stores at every Tahsil level across the country. Access to a variety of herbal and traditional medicines will be made possible by these stores to the public, improving public health care in both urban and rural areas. And third is of inclusion of Ayush packages in Ayushman Bharat Pradhan Mantri Jana Arogya Yojana. During the review meeting of the ministry, it has been decided to incorporate Ayurvedic packages under the Ayushman Bharat Pradhan Mantri Jana Arogya Yojana to incorporate Ayush treatment into the mainstream of healthcare. Under this, 170 packages has been finalized and this number can be increased as per the requirement. And ministry has come up with an aim that promoting the one herb one standard initiative. On August 6th of 2024, the Pharmacopoeia Commission for Indian Medicine and Homeopathy and the Indian Pharmacopoeia Commission signed a historic memorandum of understanding to carry out the one herb and one standard initiative with a larger objective to improve quality of medicines in this sector. And one important milestone achieved is of donor agreement with the World Health Organization. A donor agreement was signed by the Minister of Ayush and WHO on July 31st, 2024 at the WHO headquarters in Geneva to establish a traditional medicine center in the India itself at Gujarat state Jamnagar. MOU with Vietnam and medicinal plants. India and Vietnam countries took a memorandum of understanding centered on cooperation in medicinal plants on August 1st, 2024. Major campaigns and initiatives of the ministry. The first is of Har Ghar Har Ayur Yog campaign for a healthier India. The Har Ghar Har Ayur Yog initiative was started by the ministry with the goal of increasing the uptake of Ayurveda and yoga in communities, including yoga in the schools for the Fit India program. Bharat Ka Prakriti Parikshan Abhiyan has been initiated to be at the core of the initiative, and the broad roadmap to involve stakeholders across the country has been prepared. Ayush camps for geriatric populations. Ministry of Ayush committed to organize 10,000 camps for elderly citizens within the time frame of 100 days. Beating the target, 14,692 Ayush camps were organized around the country in a massive outreach effort to meet the healthcare needs of the elderly. Free consultations, therapies, and guidance on holistic health using Ayurveda, Yoga, Unani, Siddha, and Homeopathy were offered at this campus. Establishment of Phase 2 of All India Institute of Ayurveda at New Delhi. All India Institute of Ayurveda Phase 2 to be an advanced center for Ayurvedic research and treatment. A 194-bed hospital and Ayurvedic sports medicine complex and Panchakarma treatment rooms were among the amenities included in this phase. At a total cost of 289.05 crore, the project will greatly improve Ayurvedic research and training capabilities. Establishment of National Institute of Ayurveda Panchkula, Haryana. This is one of the milestone has been initiated. The National Institute of Ayurveda coming up in Panchkula, Haryana with a budget of 294.91 crores investment. This institute will function as a top-tier teaching and research facility with a 250-bedded hospital for the undergraduate and postgraduate and doctorate programs in Ayurveda. And three central research institutes on yoga and naturopathy has been initiated at Orissa, Chhattisgarh, and Andhra Pradesh. And coming to this institute achievements exclusively in Tamil Nadu, the Dr. Achanta Lakshmipathi Regional Ayurvedic Research Institute, Chennai. The Dr. Achanta Lakshmipathi Regional Ayurvedic Research Institute, established on August 1st, 1971, operates under the Central Council for Research in Ayurvedic Sciences, which is an autonomous body under the Ministry of Health, Government of India. The institute is situated within the Voluntary Health Services Hospital at Taramani, Chennai, Tamil Nadu. It focuses on research and development in Ayurvedic practices. Alarari, Chennai is actively involved in clinical trials for various health conditions and offers free healthcare services including physician consultations and medicine distribution. Services provides through a general OPD, daily specialty OPD for flu-like illness and geriatric specialty OPD every Tuesday and a Marma OPD every Wednesday. The institute also conducts health surveys, awareness programs, and free medical camps under various public health research initiatives such as Tribal Healthcare Research Project, Ayurveda Mobile Healthcare Project, Swasthya Raksha Program, and Reproductive and Child Health Programs. This institute has treated over 90,251 OPD patients at this institute, and a 1,39,209 population screened for health survey, and 75,999 patients were treated during these programs. Alarari has successfully completed nearly 60 clinical trials on diseases such as dysmenorrhea, osteoarthritis, rheumatoid arthritis, diabetes mellitus, menopausal syndrome, hypertension, obesity, malaria, etc. And recent studies also focused on the impact of Ayurvedic medicines on COVID-19 like Ayush 64. Under literary research, published about 11 textbooks in local language Tamil. Under research publication, 120 research papers were published in national and international journals. The institute organized health camps and awareness programs during the significant events like Ayurveda Day, International Yoga Day, International Year of Millets during 2023, Azadi Ka Amrut Mahotsav 2.0, Poshan Maha activities, and Swachhta Hi Seva, etc. Currently, this institute is conducting clinical research on akin patients, that is pimples, involved in the healthcare survey and healthcare and Ayurvedic research in tribal and scheduled caste areas, conducting health screening for students of EMRS, Ekalavya Model Research Schools, in collaboration with ICMR, Indian Council of Medical Research, and EMRS schools, general health screening with special focus on tuberculosis, anemia, and malnutrition, and Ayurvedic interventions for better health outcomes in students of Ekalavya residential model schools functioning under Ministry of Tribal Areas. This has been selected in the area of Salem district.
Salem and
Kalakurchi. Honoring Ayurveda pioneers, preserving the legacy of eminent Vaidyas through the admirable personalities to transform Ayurveda project by CCRS IMR projects. Planning for already initiated this MOUs with the Ayurvedic Medical College of Chennai and IMCOPS. During 23-24, a total of 13,009 patients were treated, conducted two number of clinical trials. Approximately 24,57,399 rupees has been spent towards the distribution of medicine, and 6,10,000 rupees were spent towards the investigations during this year with all the projects till this October itself. During 24-25 till date, a total of 6,189 patients were treated with under various programs. This is the brief achievements, activities going on at Achanta Lakshmipathi Regional Ayurvedic Research Institute. I request our Dr. Srinivas also to speak few points about the achievements of this.
This is established in 1971. So from that onwards, we are conducting clinical trials, mainly this Central Council for Research in Ayurvedic Sciences, which is the apex body of the India to conduct the research in Ayurveda lines. CCRS means Central Council for Research in Ayurvedic Sciences, which is the apex body for the conducting Ayurvedic research and promoting the research and promoting the developed products to the nation. So it takes the priority, national priority diseases and national priority medications to conduct the research. It will select on that basis. priority on the local areas and national areas. So we will select the diseases according to the local
Prevalence.
area
Prevalence.
from our OPD, and outreach activities like public health research also we are conducting. From public health, we are also conducting the research there also. So according to their locality, what are the prevalent diseases are there, we will take the diseases and we will conduct the research. And now last 2014 onwards, we are conducting tribal research healthcare program. Under that, we have covered last 7 years Tiruvannamalai district, Tiruvallur district, Kanchipuram district, and Salem district, Kallakurichi district. About these, all the districts we have covered. About 1,30,000 patients we have covered for this program, under this program. And in local area in Chennai also, we have taken up with the scheduled caste tribal research plan under schedule fund. Means we have been allotted every year about 1 crore rupees for this tribal and scheduled caste programs, each about 50 lakhs, 50 lakhs, or 60 lakhs, 60 lakhs. Since last 2014, we are spending, or we are giving services with that amount. So we have good number of achievements are there. We have educated the people. We are conducting the door-to-door surveys in that local areas, or that tribal areas, and this scheduled caste areas. We will go to the their house. We will take the health survey. With that health survey, what are the problems they are facing, we will identify, and according to that, we will treat the patient at their doorstep only. Investigations also, what are the blood investigations, required investigations also, we will conduct there only. We will take the lab technician there, and we will conduct the required investigations also there. So these are the things we are doing. With this, apart from this, whatever the national programs like Ayush Ayurveda Day, National Ayurveda Day, like Yoga Day, like this different programs, whatever they are allotted from the headquarters Delhi, we will conduct according to this. So these are the things we are doing here. So we have since last 71 onwards, so several clinical trials we have conducted. We got, this institute got about 13 gold medals on conducting research and publishing the research papers. 13 gold medals is the achievement of this institute.
And another important is the Ministry of Ayush has directed to have the Ayurveda Day. It has been initiated and the Modi government has started. That is today, this year we are going to celebrate 9th Ayurveda Day celebrations. Already the countdown has been started since 3-4 days back, and the Dhanvantari Ayurveda Day is going to be celebrated on 29th of this month. So in that we have initiated that from 19th of this month, inauguration of Ayurveda Day has been started, and exhibition come mini expo is conducted, and in 19th we have conducted awareness lecture at OPD, outreach programs, AMHCP, TSRP and EMRS, and on 22nd webinar roll on Ayurveda, and 22nd quiz competitions also initiated, and 23rd we are flagging tomorrow cook competitions, and in 24th an awareness lecture program in the SSB project, and in 25th we are going to have this medicinal plant sampling free distribution at OPD and SCSCP camp and TSRP, and awareness classes on 25th and 26th at TSRP and SCSCP programs, and in the 29th we are going to have the Dhanvantari celebrations by having the Dhanvantari Puja. This is all about the Ayurveda Day, which is going to be celebrated on 29th of this month, and few achievements, key achievements of the Ministry of Ayush during last 100 days. About 552 Ayushman this hospitals has been started at Tamil Nadu. In that, these programs 170 whatever initial packages are there. For example, right from the fever to the all diseases and panchakarma, whatever the projects we have, that will packages will be given to the patients which are coming to those Ayushman hospitals, Ayushman Mandir hospitals. 1469 NABH evaluation has been taken up. Out of that entry level, basic entry level, NABH evaluation has got 1046. But whatever the hospitals near about all over India, we have near about 4000 around. Out of that, NABH accreditation has come up for the 1400 during these 100 days.
The ministry has expected 1,000, but it's
Crossed
that's
to
become
1400.
crossed.
The target was fixed only 1000.
No,
Yes,
that
exactly.
is-
We are happy to share the thing with the Tamil Nadu government that this institute has been started in 1971 and striving for the exclusive for own land. For that, last 5-6 years, ministry is putting its efforts to have land from the Tamil Nadu, and now the Tamil Nadu government has pleased to allot 3 acres of land, that too free of cost, to the Ministry of Voice to establish a model research institute under the CCRS to provide the healthcare to the community of the entire Tamil Nadu, and to have the one more detailed laboratory also in that 3 acres of land. That land is also earmarked, that is at Avadi Red Hills. So it almost all table exchange stage is there. It will be definitely a grand opening for this Ministry of Voice by having that land.
Here we have only OPD facilities.
Only
So
OPD.
we have not having space in this VHS campus. So it is restricted what established in
1971.
1971. So from there, what they have given, no, that is only there. There is no scope of expansion. We have several requests we have made with the secretary. They are not allowing us to expand. So with that only, we are now running a OPD there, and these public health programs are
Yeah.
outside. So with that, average OPD it comes under 100 to like that. Where 50 patients outside we are getting daily in Salem.
You
we are
explain
getting
that program.
50
We
to
have that
20
one
patients.
SCSP program.
So like
Every
that,
year we are conducting that program.
Average, if you are seeing 100 to 120 patients we will get altogether. So here we have facility only one OPD like that. So we are taking extension of those things. But
Under that SCSP program, every year this institute will be selecting 5 areas within the urban area of Chennai. So that 5 areas, if Monday one area is selected, that particular area will be visited every Monday by the team of 2 doctors, 1 pharmacist, 1 lab technician, attendant, and with one vehicle we will go to that area and we will make the survey of the
health
public
survey,
there,
health
and we
survey.
will extend the OPD services also.
And investigations also.
Investigations
We
also.
will take the lab technician, we will take the investigations also.
Ayush was earlier in the Ministry of Health and Family Welfare. When the Modi government has been formed in 2014, it has bifurcated and created an independent ministry, that Ministry of Ayush with a cabinet rank of minister. Presently, we have the Jadhavrao Pratapji. So, whatever the budget allocation, whatever the earlier was there, it was almost all 10 to 20 folds it has been increased in the last 14 years. And coming to the CCRS, whatever you have, Central Council for Research in Ayurveda, the budget, if when compared to the last 10 years back and this year, it has increased like anything. That is why whatever the research and the outreach programs, public health programs is going on, it is very happy.
Recently, we have already conducted COVID studies also here. So with that COVID study, we have about 980 patients we have recruited throughout Tamil Nadu. For that, we maximum 99% we got COVID positive, get negative within 8 days with our Ayush 64 medicine. So that also we have done. Ayush 64 Ayush 64 is the tablet name. It is works for the COVID-19 mild and moderate symptoms patients, not severe patients. We have given mild and moderate patients. We have selected throughout Tamil Nadu with a protocol we have framed, and with the help of some NGO, we have gone through all the states, all the districts. With the help of them, we have reached the medicine to them, and we have conducted clinical trial. We have got the data and analyzed, about 90 to 98% got good result.
This is one of the selfie point we have created for the in view of the 9th Ayurveda day. It will be 3 or 4 we have prepared for the institute purpose, and we will be shifting. For example, IIT institute is there. They will keep one day there, and whoever the students will be there, they will be taking
Take
their
a
selfie
selfie
and they will be
and upload.
uploading their photo, that whatever that hologram will be have. So it
Uploading
is
photo
nothing but of propagating of Ayurveda day and reaching the public.
Website you can upload directly with selfie.
You can also have your selfies and you can
Selfie also
upload.
you
It's a
are-
request from our
you
side
are-
also.
The only lack of this is only space. We didn't have any individual.
We know that Arvivatham and all.
That is there, no? That is there. But individual building it is there means we can do our whatever we want to do, we can do. Now we have arranged one tent there no, in the morning. So that is with the request of them we have arranged it. They have not give permission to do on our own.